Aaron Coleman here from Akron Buzz, speaking with Donna Skoda, Health Commissioner of Summit County Public Health. Donna, welcome.
Well, thank you. I appreciate it.
Absolutely. Thank you again for joining me. A lot has been going on since the virus had first taken flight in early March, mid-March. What has the last several months been like, not only for you personally, but also for Summit County Public Health?
Well, public health by nature responds to crises. So it isn't anything that we haven't planned for. I'm not so sure anyone could have seen the breadth of what was going to happen or the magnitude for which this is going to take the world by storm. So it's been an interesting time in that we have had to put into place many of our emergency operations planning. We have had to work closely with Summit County, the executive's office, as well as the emergency management agencies, local responders, hospital systems, to make sure that we were able to handle the number of cases that were happening in Summit County. So although it has been extremely busy, we are now working a 7-day work week around the clock. It has also been a time that we knew was always a possibility that public health would have to deal with.
Absolutely. And talk about the recent recommendation that the board made, Summit County Public Health, to make sure that schools within Summit County went online. That just came down the pike recently. Talk a little bit about that.
Yeah, well, the school recommendation came out basically yesterday, Monday, and that was written in conjunction with many of what the school district's plans and what they were planning to do anyway. What we came up with was recommendations based on disease transmission and spread. The educators have options. Every district is different. Every district has more different amounts of children. They have different buildings. They have different configurations. They have different technological capabilities. So each of the schools can actually formulate a plan. We wanted them to be aware of what the disease transmission risk was. So when you're all together without much social distancing or masking, your risk is the highest. When you do a hybrid model where you decrease class size, you have children in school some days, out of school some days, you then have decreased risk.
Right.
The absolute lowest risk for disease transmission would be online. However, that is a recommendation from a disease perspective. Educators have to take into consideration their own situation and do what is really best for their schools, their students, and their communities.
Absolutely. And Donna, what kind of testing is available in Summit County for those who think that they might have contracted COVID-19, or for people who are curious as to the different kinds of testing that is out there? I mean, what can you tell us there?
Well, testing, unfortunately, because as you know, around the country, we've seen quite an uptick in cases all over the entire county, particularly the South, Florida, Texas, the Carolinas, Mississippi, Georgia. There's been some increases, significant increases. So with that, a lot of the testing capability in Ohio has gone with it. So unfortunately, it's difficult to get a test right now if you were just wanting to know if you've been exposed to COVID for the active disease, okay? So you just can't really, it's difficult. Rite Aid, CVS, the hospital systems, they do have testing available, and most of that is for 18 years of age and older. Children's Hospital has some testing capability for their network, and Cleveland Clinic does some children's testing as well. But the issue is testing, again, has become a difficult situation. And as we reopen layer by layer, and now we're talking about layering on the school risk, we are in a very similar position as we were in the spring, early spring, when we started to open up the economy again and we did not have adequate testing. So it really has to be, we're encouraging individuals to get a test for active disease if you have symptoms. Call your physician and get a test. If you do not have symptoms or you have not been exposed to someone with COVID-19, you should not try to get a test right now. It is just too difficult. Now, there are other tests that you can get, and one would be an antibody test. However, all of those have had like an emergency use authorization from the FDA, and not all of them have been proven to be created equal. And we don't know if they're picking up on just the typical old cold coronavirus or they're actually picking up COVID-19. And then there is an antigen test that can be administered, which can tell you if in fact you're negative. But if that antigen test comes back positive, you still have to have the PCR test. So with that said, it's best to talk to your physician. It's best to determine what your needs are with medical advice. And if you do get a COVID test, you should stay home until you get those results. Because it doesn't do any good to go get that test, walk around out in the free community doing everything you would have done, because if you are positive, you could be spreading COVID-19.
Right. And you had alluded to it a little bit. The fact that we're pretty much back where we started as far as, you know, cases going up and everything like that, like we were in the spring. Donna, in your professional opinion, is there a possibility of another possible, whether it's a partial shutdown or a complete shutdown? I mean, I know people don't want to hear that. I understand where people are coming from in that regard. But, you know, with everything that's going on, is it a distinct possibility?
We're not sure. I can say this to you though, Aaron. I think what's happened is the governor is trying desperately to allow COVID and businesses and a normal life to coexist. And that depends on each and every one of us and how willing we are to practice safe habits. And I think what you're seeing is the governor's trying desperately to let things stay open, to really get used to living with COVID-19, because it will be here for a while. And we're not going to have the opportunity to just say, oh, it'll be gone in 3 months, it'll be gone in 4 months. It won't be gone until we get a vaccine that works, has some efficacy, and that we can actually get a handle on what this virus is. So he's trying to do that. We are trying to encourage individuals to be as compliant as you possibly can. I think what has happened is you have seen these strategic moves on the governor's part, where now bars can't sell liquor past 10 o'clock. You can stay in the bar and you can eat food and you can hang out, but you cannot sell liquor past 10, hoping to disperse some of the crowds. We fully expect to have some sort of recommendation about these large gatherings that are happening that aren't really meeting the letter or the intent of the rules that have been passed thus far. You know, we still have in place a 10-person rule for the general public, but yet at your private home, you can have as many people as you want. And just because you're allowed to do it doesn't make it a good idea, not during a pandemic. So whether or not he will completely reverse, I know there have been some opinions at a much higher federal level that we should try to look, you know, there's been some research done about a shutdown would be the best thing to do, but I'm not so sure that's feasible, knowing that we're going to have to live with this for a while and that we need to get used to getting good at how you protect yourself and your family. We really have to get good at that.
Right. And have you seen an improvement yourself, just in your outside, just being around? Have you seen an improvement in social distancing with people and folks wearing masks when they go out and do their daily tasks. Like, have you seen that? Because personally, I have.
Yeah, and I would agree with you, Aaron. I've seen it too. I think people are trying to do the right thing. I think in Summit County, we've always had individuals that have tried to do the right thing. And I think they realize the link between keeping our economy open and schools staying open.
Right.
So I have seen, I'm very limited in my activity. I do very little in the outside world because I'm trying to do my part. I wear a mask. I think we all are. We're trying to socially distance as much as we can. Even in the work environment, we socially distance, we wear masks, and we are trying to be as proactive as we can because we want us to all get through this together. And we want to be able to keep kids in school and have our businesses thrive and be successful. We don't want to see people be out of their livelihoods. And that's what happened the last time with the lockdown. People lost their livelihoods, and we don't want that.
No, we certainly don't. And there's been a lot of you know, talk going on about the college football season and everything else, you know, and typically, you know, there's gatherings where a lot of people are. And,
Oh, yeah.
you know, right now, as it states, you know, in your professional opinion, I mean, there's probably not a lot of wiggle room, so to speak, when you're talking about holding an event where a lot of people are going to be. It's just, you just, right now, it's just not in the cards.
Well, it's not a good thing to do. It's just, I mean, it's not in the cards, and it's really risky behavior because I think if we understood, if we had some sort of way of knowing that this virus, but we don't know who gets really sick. Some
Right.
people get really sick. And then there's a whole group of people now we know that are having the impact of the virus, still have symptoms 5, 6, 7 months later.
Hmm.
They're having organs involved, they're having nervous system, heart, kidney. People are having a lot of needs and they're needing rehabilitation. They have been ventilated, they have lung damage. I mean, people are really not recovering. Everybody doesn't recover equal. So we don't know. And that's one of the fears. If this were some virus we were really used to, it would be different. But this virus has behaved very differently.
Right. And, you know, there's just a lot of liability involved with all the universities and everything. So, I mean, there's, as of right now, this moment, there have been 27 teams that have decided to forego the 2020 fall campaign in hopes of possibly playing in the spring or something like that.
Right.
But yeah, go ahead.
No, I just wanted to say it's unfortunate. I don't think I'm not even a big football fan. I don't even understand it really, but I have to tell you, I feel bad for people who can't do what they want to do.
Right.
And
And I am a football fan. And one of the things that I do is I write a podcast for one of for a university down in West Virginia. But you know, it's very unfortunate. It really is.
oh, it is, and it's hard on, and people have worked their lives. They've trained, they've invested, money and time and effort and energy to be able to play in sports. And it's hard. It's just like, we've, our world, we just got dropped into an alternate universe in March.
Right. And last question here for you, Donna. You know, obviously, um, you know, there's been many different vaccine trials and things like that have been going on, not only here but throughout the world.
Mm-hmm.
Where, what happens from here? Like, how far away are we? To be honest with you.
Well, if you listen to Dr. Fauci, he's predicted sometime next year that we would have some vaccine that might be viable. And again, because it's a novel virus and it appears to have different levels of antibody creation and that, it's difficult. The flu virus every year, Aaron, we make a new one every year based on what
Hmm.
happens in the southern hemisphere. And it's
Okay.
either a good match, a partial match. it appears as though COVID might be heading in that direction. We might need to see exactly the how it long you can get immunity with a vaccine, and if it's a sustained immunity. You know, the flu vaccine really only lasts about that 5 to 6 months, and that's why you get it every year. So I think the big answer is going to be is figuring out exactly how this virus works, what kind of vaccine is necessary, and will we have to get it every year? What does it look like? And then you have to hope and get enough people that want to take it to actually get some immunity. You know, there's still a lot of people who won't even take the flu vaccine.
Right.
So, I mean, we're really going to have to do our education and promote this to help people stay safe, especially if you have underlying health conditions or any sort of chronic lung problem, kidney, you know, heart, high blood pressure, obesity, any of those things where we know that's a risk factor for getting sicker with COVID-19.
Donna, thank you very much for joining us here on Akron Buzz. We certainly appreciate it, and thanks a lot.
Thank you, Aaron. Bye-bye.
Bye-bye.